Did you know that in our country, every hour a patient dies of oral cancer? Less than 20% of dentists use any kind of aid to help them in the diagnosis of oral cancer other than visual and tactile. Now, we can do better.
This episode of Take 5 is dedicated to oral cancer awareness. April is Oral Cancer Awareness Month in the US, and in the UK it's November. Oral cancer is not limited to 1 month. Every hour of every day, someone dies from oral cancer. You need to be screening all of your patients. It is your responsibility. Past surveys indicate that many dentists do not routinely perform an oral cancer screening. This is really unfortunate, because the face of oral cancer is changing. Young males and females are becoming the victim of this horrible disease, and the reason is human papillomavirus, HPV, which is transmitted via oral sex. Many of these victims of oral cancer have no risk factors, and there's a poor long-term prognosis. The 5-year survival rate for oral cancer is just 57%. It takes 4 years for dysplasia to turn into cancer. How do you tell a patient who comes in every 6 months for their checkup that you may have missed it? Every patient needs an oral cancer screening, and make sure you tell them you did it. Oral cancer detection is your responsibility. Welcome to Take 5 with Marty. Today I have Eva Grazel with me, an oral cancer survivor. Welcome, Eva.
Thanks, Marty.
A champion for early detection, Eva founded an oral cancer awareness campaign, 6-Step Screening. Her passion to save lives was fueled by her experience as an oral cancer survivor. Eva speaks worldwide at dental meetings, healthcare association conferences, and cancer centers. Eva is an author, and her second book, Mr. C Plays Hide and Seek, is being released in June. Today, Eva will be speaking with us about oral cancer screening. So, how did they tell you you had oral cancer?
Well, I had a sore on my tongue. It just wouldn't go away. It was biopsied by an oral surgeon, and I was told it was hyperkeratosis, nothing. 2 years went by, and I had no symptoms. But you know that early stage oral cancer is often asymptomatic, and you don't feel it. The sore came back right over the biopsy site. I was treated for biting my tongue. I had a night guard made. I was using saltwater rinses and gels for the pain until I got an earache. And the earache was excruciating on the same side. I went to a general doctor to look in my ear. He told me I had water on the eardrum, 10 days on antibiotics, and the excruciating earaches continued. And I went back to my oral surgeon and I said, I am desperate for answers. I can't live like this. And he said, let's do another biopsy. And I left his office after scheduling that biopsy thinking to myself, maybe I should look elsewhere for answers.
Ultimately, who made the diagnosis of oral cancer for you?
I happened to have called up an old family friend. He was a plastic surgeon at Mount Sinai Hospital in New York City, specializing in cleft palate. So I thought maybe he'd know what was going on in my tongue. And he told me he had no idea, but I should get to a medical center. So I went to Mount Sinai Hospital by myself. I took the bus into Manhattan that day from Pennsylvania, not having an inkling that what was on my tongue was remotely serious. And Dr. Erkin said, who are you here with? And I said, well, you know, my mother will pick me up whenever we're done. And he said, oh no, you need to be here with somebody. And that day, he told me when my mom was sitting by my side that I had an advanced squamous cell carcinoma on my lateral tongue.
Wow. So, what was it like to undergo treatment for oral cancer?
Well, for me, I was young, and they wanted to do whatever they could to get rid of the cancer the first time. So I had radical surgery. They removed a third of my tongue and reconstructed it from my arm and my leg. They removed my sternocleidomastoid muscle because so many lymph nodes were clinging to it, and all of them had to be removed. And because they found cancer floating in the lymphatic tissues beyond the lymph nodes, They wanted me to undergo a maximum dose of radiation.
How long's it been since you've been cancer-free?
13 years.
Well, that's wonderful, but what was this whole episode like? I mean, when you look back on it now.
You know, when I look back on it now, I still feel, and you could sense it probably, I feel uncomfortable because I don't know where my treatment went wrong. Why didn't they know what was staring at them on my lateral tongue? Why was I diagnosed at stage 4?
And we may never have answers for that. Eva, thank you for giving us your wisdom on what it's like to be an oral cancer survivor.
Welcome.
So, we now know a different side of oral cancer, one that most of us will never experience. Diagnosing a patient is one thing. Understanding how it affects a person is another. Screen your patients. It's very important. Eva will be back on the next episode of Take 5 with Marty, and we'll go through some of the things that you need to know to protect your patients from oral cancer.